Hey everyone, it's Dr. Corey Babb here from the Haven Center for Sexual Medicine and Vulvovaginal Disorders in Tulsa, Oklahoma. I'm so sorry that I can't be there in person, but we've had some family things come up, and so I'm actually in Houston at the moment, not even in Tulsa where I'm from. But I wanted to put together this video for you, and I also have a PowerPoint presentation that I've sent via email. So if you have that, you can follow along, or you can look at that kind of after we're done. I'll go over everything that's in there, obviously, regardless. So first of all, I wanted to say thank you for letting me kind of do this talk for you. This is something that I'm very passionate about, and it's something that I believe is very, very important when it comes to just kind of being a, in my case, a gynecologist, but this is stuff you can use really no matter what specialty you go into, whether that's, women's health, whether internal medicine, family medicine, I mean, in theory, even radiology, I guess, why not? But trauma is something that, I think it acts like a folder that's sitting on top of a file cabinet. And, if your file cabinet is your memories, if you every time you go to access those, that folder is sitting right there. And so it kind of influences everything that you do and everything that kind of goes into that. And with pelvic trauma, it's something that we see can have very long-term consequences. We have patients that come in that are unable to engage in any type of sexual activity, or actually any type of penetrative activity, even like putting in a tampon or having a pelvic exam that steams, or, that actually comes from basically a previous traumatic pelvic experience. And I've had more than one patient say, well, it all started when I had a really bad pelvic exam. And so these are things that you can use with your patients, especially really young patients. If you have to do, a pelvic exam on a teenager or someone who's never had any type of penetrative activity, these are things you can look at. So, all right, we'll get started. So obviously this is on trauma-informed pelvic exams. Conflict of interest there, not that it really matters too much of this, but there they are for you all. I use the term female for convenience in this lecture. It's not meant to be exclusive or exclusionary in terms of gender, biologic, sex, or identification at all. So, really what we're looking at with our kind of this little mini lecture here is three things. So we're going to define kind of what is a trauma-informed pelvic exam. We're going to basically kind of determine how to prepare patients for that pelvic exam. And we're going to discuss how to be an ACE, kind of coined this, at trauma-informed pelvic exams. So, yeah. So first of all, kind of what is this trauma-informed pelvic exam anyway? So a trauma-informed pelvic exam is an exam that acknowledges that patients have had a different experience from the examiner. And this is something that, you think about, if you're doing pelvic exams frequently, when you see this, patient, whoever they may be, comes in, this may be your 10th, 20th, 30th pelvic exam of the day. But this may be something that, they only have once a year. And if they're, really anxious about it or things like that, that can be really, problematic. It can make the exam much more, traumatic for that patient. And it goes into kind of the second point here. An exam, trauma, a pelvic exam that kind of takes into account anxiety about previous pelvic experiences. Like I said, we'll see all the time some very well-meaning family members that are like, oh, that's going to really hurt, or that first pelvic exam is horrendous, whatever it may be. And so you want to keep that in mind. Trauma-informed pelvic exams keep an individualized, approach to each patient. If this is a patient that, has never had a pelvic exam before, you may be a little bit different than someone that's, previously, been raped or something along those lines, but you want to individualize that approach to that patient. And obviously, a trauma-informed pelvic exam, by definition, should be an exam that is as atraumatic as possible. Easy to say, not always easy to do, but that's definitely something you want to keep in mind. So how do we prepare, patients for these pelvic exams? So the first thing is you want to provide context for the exam. When I was first in practice, I was doing lots of obstetrics. I remember a patient that, we just basically had, I was always trained, and you may be trained too, a new OB visit, they always get a, full breast, pelvic exam, pap smear, gonorrhea, chlamydia testing, the whole shebang. So this patient came in, And I said, okay, we're gonna do this. And she said, no, I just had that literally like a month ago. And I said, well, but we need to do these. This is what we're supposed to do. And she ended up refusing. And I remember thinking to myself, well, that's odd. But really, like when you think about it and step back, I mean, she just had that whole exam a month, like things, with obviously the exception of gonorrhea and chlamydia, are probably not going to change in terms of that whole other stuff there. So you need to provide context for why you are doing this exam. What are you hoping to find? What are you looking for? Things like that. The second thing is to help the patient conceptualize the exam. And I'm sorry if you're looking at the PowerPoint, I guess the box was not big enough for conceptualize. So that E has gotten moved to the next line there. But tell them what's going on. What are we going to do with this? Like, are we going to, we're going to listen to your heart first. We're going to listen to your lungs. Okay, well, most people kind of are okay with that, but you may find someone that's not. But with pelvic exams, this is obviously a very private area. This is an area that a lot of people are not going to be showing to many people throughout their entire life. And so it's something that you really want to, help that patient conceptualize what's going to be going on. So tell them, okay, in this exam, this is what we're going to be doing. We're looking at this, this, and this. If you have to use a speculum, this is what a speculum looks like. If they've never seen one before, these are the sounds it might make. This is what it might feel like, things like that. Probably the most important aspect for the exam itself is to receive consent for the exam. I cannot stress this enough. This is what allows your patient to have agency, really about this. Like, that gives them power to say, no, I'm not ready for this, or, okay, I'm fine with that part, or I'm not fine with that part. Like, don't take it personally. It's not that, they think that you're smelly or something like that. It's that they are really looking, they need to feel that they are in control of this experience, especially if they have had previous pelvic traumas. That will be something that will allow them to, feel more comfortable and relaxed with it, and will make the exam actually easier to do. And this may be something and it should be actually something as simple as, is it okay if I touch you? Is it okay if I listen to you? Is it okay if I move, the drape that we have for the pelvic exam? Is it okay if I proceed with it? Things like that. And it may take a little bit of time, extra, as opposed to you just being like, whoop, 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 whatever it is. But the reality of it is that patient will remember that you took the time to ask if they were prepared for the exam. And obviously, communicate throughout the exam. And for some people, this is small talk. I remember I had some, instructors in the past that would, say, well, always ask the patient about the weather during their exam, or ask them what, how their kids are, how their family is. I mean, that's fine if you want to do that. And if the patient obviously is doing that, is kind of initiating that type of talk, great. I find that, it's kind of a little bit awkward for me to be like, so tell me about your kids as I'm, doing a pelvic exam, but that's just my experience. But regardless, you want to communicate through the entire exam itself, and this kind of goes into the previous things with that conceptualization. This is what, we're doing. This is what I'm feeling right now. Do you feel this? Does it feel sharp? Does it feel painful? Does it feel whatever it may be? If you have a means to show the patient what is going on, I would 100% recommend that, and ask them obviously if they're okay with that. But that helps them visualize stuff too, and kind of provides that sense of control. So like in my office, we have what's called a vulvoscope. We actually use it for, vulvoscopy, looking at the vulva. You can use it for colposcopy too, or vaginoscopy. But it's hooked up to kind of our computer screen there, so the patient can see everything that I'm touching, everything that I'm doing. And so I can say, okay, you're going to see me, I'm going to touch over here on the, left side of your, labia majora here, and we're going to kind of, touch here, and, you're going to feel that, and okay, does that hurt? Whatever it may be. So you're communicating with them throughout the entire exam. So how do you become an ACE at trauma-informed pelvic exam? So I put that little acronym there so you can remember it. I know when I was in medical school, acronyms help me remember things. Maybe it will help you too. If not, you can be like, whatever, that's stupid. But if you use it in some way to commercialize it, please include me in your royalties. That would be really awesome. So how do we be an ACE at trauma-informed pelvic exam? So that's AACE, obviously. So the first A is acknowledge. Acknowledge that patients have had different pelvic experiences than you have. Everyone is different. Your life experiences when it comes to pelvic, penetration, trauma, whatever it be, are going to be vastly different from somebody else's. And remember, and this is a separate topic, but it flows into this. Roughly 20% of patients have experienced some form of sexual violence or sexual trauma. And obviously there should be nothing sexual about this exam, but that's a fifth of all the people you will see statistically will have experienced this. So you should be doing this at a bare minimum 20% of the time. And not that you should be saying, well, okay, if you've never had that, I'm not going to do this. But it's out there. And if you're not asking for it, or asking about it, acknowledging that, you're going to miss that. The second A is agency. Let that patient be in charge of their body. They are in charge of it. You do not have the right to go in and to, do these kind of very invasive procedures without that patient allowing you to. They get to be in control. And I said, let them guide the exam there. So, if they need to take a break, great. If this is something, if you're on time constraints and they're really anxious about the exam, maybe you can go through with, what you're going to be doing before the exam. And if they need to reschedule to have the exam itself, there's absolutely nothing wrong with that. I'm a gynecologist. I don't care if you're on your period or you're not, but I do have a lot of patients that come in and say, hey, I'm on my period. I don't want to have a pelvic exam right now. That's fine. It's not going to bother me. We'll reschedule you just for an exam. It's not a big deal at all, but give them that agency. Let them guide that exam. The C there stands for consent. Always, always, always ask for consent. If there's one thing that you can take home from trauma-informed pelvic exams, it's consent. Make sure the patient is okay with you doing what you are doing. Don't just assume that because they're there and they're, in an exam gown or sheet or whatever you happen to use in your clinic or your office, that they're okay. And this goes not just for the office, but also in the emergency department, which is where unfortunately a lot of patients get their first pelvic exams. It's already horrendous to be in an ER if you've been in one recently, and then to kind of have a really rough pelvic exam too can just make things worse. And I know that, a lot of our ER comrades are there to kind of, make sure the patient's not going to die, and they're really awesome at that. But that little extra step, making sure that they're okay with that exam, can be really helpful. And finally, that E in our ACE kind of acronym stands for education. What did you find with your exam? What did you learn? Why was it important to do this? You think about a well woman exam, patient coming in for their annual, and part of that includes, a pelvic exam, and depending on where they are kind of in their timeline, a pap smear. Well, why do we do this? Why do we do pelvic exams? There was an article that was put out a little bit ago saying, should we even be doing pelvic exams anymore? We've got ultrasounds, we can screen for STIs in the urine, we could do this and all these things to try and avoid that. And, I think that a pelvic exam that is done properly, while no one is ever going to want one, is something that does not have to be traumatic. There are kind of techniques that you can use to make that less traumatic. Obviously, kind of our ACE acronym here, you can kind of apply a lot of pressure in Alcock's canal. That's kind of where the pudendal nerve comes out, and goes to your external genitalia. And if you apply pressure there, sometimes it kind of deadens that sensation, especially if you're having to place a speculum into the patient's vagina. But so what did you find? Okay, everything was good. Everything felt, very normal. I didn't find anything bad. That's not a bad thing. You don't have to be like, well, I'm sorry, everything was normal. That's great. We want you to be healthy. But if you found something, okay, hey, your cervix feels like it's really kind of rigid, or, your uterus felt kind of bumpy, whatever it may be. What did you learn? Okay, well, because of this, now I can do something, I think I want to kind of go on and find some more information. Why was this exam important? Well, this is for your overall health, or, hey, what we found makes me wonder if we need to do some additional testing. So anyway, those are kind of the AACE things, so you can be an ACE at trauma-informed pelvic exams. So obviously here is my contact information. I know we're getting in on time here, but feel free to call or text me anytime. If you want to do rotations, happy to take med students. We do a lot of stuff at Haven that you won't see at a lot of other places, especially if they're not sexually medicine or vulvovaginally, kind of directed. So anyway, thank you again for letting me come and give this talk kind of virtually in this case. I hope the rest of your conference goes very smoothly and that you have a wonderful rest of your day.